Thank you for exploring our series of short videos intended to provide practical information on oral health. These videos were developed with caregivers in mind, whether you're taking care of a loved one at home or you're a professional working in a care facility. These videos provide tips on oral care practices and include information on a range of oral health conditions. Please keep in mind that it takes many years of study to become a dentist. We are sharing some of our knowledge that we have gained in dental school and over our years of caring for patients. Hello, my name is Dr. Sally Cram. I'm a member of the DC Dental Society and the DC Dental Society's Foundation. I'm here today to speak with you about the importance of oral health in the elderly and disabled populations. Let's talk a little bit about aging and health. Of people over 65 years old, 43% have some form of hearing loss. 1 in 6 have vision issues, many have oral health problems, and 25% may not even have their teeth. Again, in this population of seniors, 24% have type 2 diabetes. Heart disease is the leading cause of death for most elderly individuals. 92% of our seniors have at least one chronic disease, and shockingly, 77% have at least 2. 1 in every 5 persons has untreated tooth decay, and here is the big one, 68% of our elderly seniors have some form of periodontal or gum disease. So what factors can affect oral health? Well, certainly in older individuals, many of them are retiring and they lose a sense of purpose. They don't have that schedule every day. They don't have the same commitment. They may lose their insurance if they retire. They have a lot of change in their habits, such as regular doctor dental visits. Many have financial security issues. With the loss of a job or retirement, they're now looking at Social Security or Medicare to cover their financial expenses. Many find themselves in depression because they see people less. They don't see their coworkers every day. They have less frequent social contacts. And of course, we all know that when you have less social contacts, cognitive decline becomes a serious issue. So why is oral health important? Well, oral health is very important because of nutrition. If you can't chew and eat your food properly, you may not be able to maintain a healthy weight. And a healthy weight and a healthy body means a healthy immune system to fight off diseases. Tooth decay, which we talked about previously, is very common in the elder population, and this can affect a person's inability to eat. They may be in tremendous pain or have sensitivity. And gum disease can lead to loose teeth, pain on chewing, even difficulty in being able to digest your food. Not to mention the health issues related to oral problems, but think about the socializing issues. Many people are very ashamed when they lose teeth. They become more isolated because they are ashamed that they're missing teeth. They may have bad breath or oral malodor, and they certainly may have issues being able to speak properly. So let's talk about how oral disease can affect your general health. 92% of seniors have at least one chronic disease, as we talked about earlier, and 77% have more than one. What are the most common ones? Heart disease, stroke, cancer, and diabetes. I'm sure we all know someone who suffers from one or more of these systemic health issues. What is the culprit and what's the common denominator in all of these diseases? It's inflammation. I'm sure you can't bypass seeing something on TV or anywhere in social media that doesn't talk about chronic inflammation. Chronic inflammation has been implicated in so many health issues. Anything from cancer, particularly oral head and neck cancers, pancreatic cancers. It's been also implemented in neurologic diseases like Parkinson's and multiple sclerosis, and even in Alzheimer's disease. Chronic inflammation has also been associated with pulmonary diseases, such as COPD. I'm sure you know many people who may suffer from that, especially if they've been smokers. Hay fever, bronchitis, all related to chronic inflammation. And then the big one, bone and joint disease. How many friends do you know, or people, elderly people do you know that have had a hip replacement, a knee replacement, osteoarthritis, rheumatoid arthritis, all related to chronic inflammation in the body? We also know that some metabolic disorders, like type 2 diabetes, one of the most common diseases in the senior population, can be related to inflammation. Cardiovascular disease has some strong correlations with inflammation in the body, strokes, heart attacks, hypertension. And then last but not least, autoimmune disorders have been linked to chronic inflammation. For instance, Crohn's disease, colitis, GERD, and even type 1 diabetes. So all of these systems can be affected by chronic inflammation. So let's talk about one of the most common chronic diseases that causes inflammation, and that's periodontal disease. As I said earlier on, 68% of seniors over 65 have some form of periodontal disease. So what is periodontal disease or gum disease? Well, when the gums are healthy, the bone and the gum tissue around the tooth is tight and firm, like a little pink rubber band around your tooth. If you're not good with removing the plaque and bacteria every day from around that tooth, the plaque builds up, and in just 24 to 48 hours, that bacteria makes inflammation in the gums surrounding the tooth. Now that nice, firm, tight pink collar of gum tissue becomes red and spongy. This is called gingivitis. Gingivitis is the early stage of periodontal disease and the only stage of periodontal disease that's actually reversible by just doing some simple things at home. Better brushing, better flossing, better cleaning of your teeth more frequently, and possibly seeing your dentist for cleanings a little more frequently. However, if gingivitis isn't controlled with simple home care techniques in removing the plaque and bacteria around the tooth, then it may progress to mild periodontal disease. This is where the gum actually becomes so loose and pulls away from the tooth that now there are pockets or gaps between the tooth itself and the gum. As these gaps become deeper and these pockets become deeper, it becomes even more difficult to remove the plaque and bacteria from under that gum collar. When the bacteria sit down there next to the bone for just 4 to 6 weeks, those bacteria start producing toxins and poisons that actually begin to melt away the jawbone surrounding the root of the tooth. So as you can see, it's sort of becoming a vicious cycle here. The deeper that crevice or pocket gets around the tooth, the harder it is for you to remove the plaque and bacteria. And as we lose more bone, the pocket gets even deeper and it becomes more difficult until eventually we end up with severe periodontitis or periodontal disease where the bone is lost all the way to the end of the root of the tooth becomes loose, very painful, it's difficult to eat or chew, and it may even fall out or be lost on its own. None of this, unfortunately, hurts until we get to those end stages. So it's really important to be aware of some of the early signs of gum disease so that you can get it under control when it's in its early stages. So how does periodontal disease or gum disease contribute to all of these overall systemic health problems? Well, we know that periodontal disease, because it is a disease of chronic inflammation, has effects on the brain, the lungs, the heart. It can cause increased risk of cancer. It has effects on arthritis, and it also is a major player in the development of diabetes, which is one of the most common diseases in people over 65 years of age. Let's take a look at each of these diseases and how they might relate to oral disease or periodontal disease. Let's first look at pneumonia. So what we see on the bottom left corner is a schematic of what a lung looks like. The lungs are actually made up of little tubes, bronchioles, and little clusters of sacs called alveoli. It's through these tubes that we breathe in air, and the oxygen then is transferred through the little air sacs into the bloodstream to supply the body with fuel, oxygen. What happens in pneumonia is these bronchioles or tubes become very inflamed. In the case of periodontal disease, from bacteria that enter into those bronchioles. When those bronchioles get inflamed, they decrease in diameter, so we're getting less oxygen into the lungs, and then mucus builds up in the little sacs, and as mucus builds up in the little sacs, air transfer, oxygen transfer is greatly diminished. So what are some of the symptoms? Might be a person would have pain or tightness in their chest. They could be coughing or wheezing, have a sore throat. Certainly might have a temperature, elevated temperature, may not feel well, have a runny nose. All of these are signs that something could be going on in the lungs. And again, what could be causing this? The chronic inflammation from bacteria that originated in the oral cavity. So what we're particularly concerned about in the elderly population is aspiration pneumonia. This is very common in dementia patients because they have a diminished capacity for chewing their food and swallowing. So what happens is when bacteria are in the mouth, as you can see on the slide to the right, that's the buildup of tartar and plaque that we talked about earlier. Pieces of this bacteria can break off and actually be inhaled into the lungs. So we can see where poor dentition, poor oral care, and periodontal disease all could play a very big role in development of pneumonia. Let's talk about periodontal disease and how it might affect diabetes. Diabetes, again, is one of the most common diseases in our older population. And we know that uncontrolled periodontal disease makes a person more at risk for developing diabetes, and it makes it harder for people who are diabetic to control their blood sugar. Many diabetics don't even realize that they have gum disease, and when they get the gum disease under control, they may find that they are able to control their blood sugar in a better method. So what we know is both of these chronic inflammatory diseases can affect each other. A higher risk of periodontal disease when you have diabetes, and a higher risk of developing diabetes if you have oral periodontal disease, gum disease, that's left untreated. Now let's talk a little bit about periodontal disease and cardiovascular complications. I love this slide because it shows how a tooth in the mouth and the gum and the bones surrounding it are not just a tooth in the mouth. Bacteria are getting into that bloodstream. You see the blood vessels, and those bacteria are traveling to the brain, to the heart, and to all the coronary system. Anywhere the blood vessels are, that's where the bacteria are traveling. And again, we're going to our inflammation. So look at a normal artery on the left. It has a nice wide center where the blood can flow through very easily. And then look at the artery on the right. This artery is blocked with cholesterol. Why is it blocked with cholesterol? Because of inflammation. When inflammation from periodontal disease gets in the blood system, it makes inflammation on the inside of the blood vessels, and it roughens that surface, making those fatty plaques and cholesterol collect and adhere, and decreasing the size of the flow of blood through the arteries to the brain and to the heart. So what happens when you have untreated periodontal disease and that bacteria gets in the bloodstream and makes inflammation? As the inside of the diameter of that blood vessel decreases, you get less blood flow to the brain, meaning you're at risk for a stroke. Or you get less blood flow to the heart, and then that results in a heart attack. We also know that Alzheimer's and dementia have been linked to chronic inflammation. 55 million people worldwide have some form of dementia, and that's expected to triple by the year 2050. Nearly 7 million Americans actually suffer from Alzheimer's. So what are the risk factors? Well, certainly genetics play a role, but we also now know that chronic health issues, especially those that are related to chronic inflammation like diabetes, hypertension, periodontal disease, there we see it again, and depression, have all been linked to a higher risk of Alzheimer's and dementia. Again, many forms of vascular dementia are caused again by what I just talked about, the narrowing of the blood vessels. Less blood flow to the brain, less oxygen, and parts of the brain begin to die. Let's talk about rheumatoid arthritis. A very common thing in the elder population is their fingers and their hands are stiff, their joints are stiff. What does that mean? Well, that means they have a lot less dexterity. It's difficult to hold a toothbrush. It's difficult to floss. May also include balance issues, mobility. Many people with arthritis are at risk for falls and trauma, especially to the head, to the teeth. So many individuals may take medications for osteoporosis. Many of these medications have a high risk for poor oral healing. For instance, if they lose a tooth or have to have some sort of surgery in their mouth, they may not heal as well as someone who is not taking one of those drugs. We also know that chronic inflammation puts us at more risk for increased cancer, especially in men. I found this statistic to be very interesting. Men with untreated periodontal disease are 54% more likely to get pancreatic cancer than men with healthy gums. And oral inflammation can be a precursor to many head and neck cancers, which is why it's always important to know what's going on in the mouth or recognize and be alert to any changes or problems that seem to be occurring in the mouth. So the bottom line to the oral health, overall health issue is a healthy mouth is going to help make a healthy body. Inflammation levels in the body can be reduced by simple daily oral hygiene practices. 98% of most oral problems, tooth decay and gum disease, are totally preventable by doing better home care, brushing twice a day, flossing or using something in between the teeth once a day, and of course, when possible, visiting a dentist regularly. We know that when chronic inflammation is controlled, the associated chronic diseases and inflammatory processes, for instance, diabetes, heart attack, stroke, may also be better controlled. So thank you for joining me today for this presentation. I hope you found some valuable information here, and will tune in for more of our videos talking about oral health and overall health.